No hospitals, no stitches, no painkillers. A single deep wound could easily become a death sentence. A cut that today would take 15 minutes in an emergency room could once take days, or even weeks, to fully overcome. And yet, ancient humans survived broken bones, deep gashes, animal attacks, and infections, again and again. This is the story of how early humans treated some of the deadliest injuries imaginable, using nothing but instinct and raw ingenuity. Long before modern surgery existed, humans were already developing the very first techniques of trauma care. In the ancient world, even a minor cut carried a real risk of death, not from the wound itself, but from what came after. Without any understanding of bacteria, infection could quietly turn a small injury into a fatal one within days. Blood loss, shock, and infection were the three silent killers behind most ancient injuries, each one dangerous in its own way. Early humans may not have understood the biology, but they absolutely understood the stakes. So, out of necessity, they began developing real, functional methods to fight back against injury. The very first instinct, then as now, was simple. Apply direct pressure to stop the bleeding. Strips of hide or plant fiber were wrapped tightly around wounds, acting as some of the earliest bandages in human history. Certain plant resins and saps were discovered to help blood clot faster, speeding up the body's natural healing response. Keeping an injured limb elevated and still, even without knowing the exact science, helped reduce swelling and blood loss. These simple techniques, pressure, elevation, and binding, remain the foundation of first aid used around the world today. Without knowing what germs were, ancient humans still noticed that wounds cleaned with water healed better than those left dirty. Certain plants, when crushed and applied directly to a wound, appeared to slow infection and reduce swelling. Substances like honey, later confirmed by modern science to have natural antibacterial properties, may have been used to help wounds heal. Covering a cleaned wound helped protect it from dirt, insects, and further damage while the body worked to repair itself. These practices, refined slowly over generations, functioned as an early, effective form of wound hygiene. A broken bone in the ancient world was a genuine crisis, capable of ending someone's ability to hunt, walk, or survive. Realigning the bone, pulling it back into a straighter position, was likely one of the most painful and most necessary procedures they performed. Straight sticks or bones were bound tightly around the injury, creating one of history's very first splints. The injured person was often given extended rest, protected from further strain, while the bone slowly healed. Archaeological evidence shows many ancient humans lived for years after healed fractures, proof this method genuinely worked. For severe head injuries, some ancient humans attempted something remarkable: actual surgery on the human skull. This procedure, called trepanation, involved carefully scraping or cutting a small hole into the skull using sharpened stone tools. It sounds terrifying, but archaeological evidence shows many patients actually survived this surgery, some for years afterward. Bone regrowth found around these holes proves the patient's body continued healing long after the procedure was performed. This may be one of humanity's earliest forms of true surgery, performed with nothing but stone tools and remarkable courage. Perhaps the hardest part of ancient injury treatment wasn't the wound itself. It was surviving the pain of treating it. Biting down on wood or leather was a common technique to help endure the pain of realigning bones or cleaning deep wounds. Some cultures discovered specific plants with mild numbing or sedative effects, offering a small amount of natural pain relief. In many cases, the only real anesthesia available was the physical support of others, holding the patient steady through the worst of it. Enduring this level of pain, again and again, was simply part of what survival demanded in the ancient world. Within most groups, certain individuals became known specifically for their skill in treating injuries. These early healers learned, through repeated experience, which techniques worked for different types of injury. This knowledge was carefully taught to apprentices, ensuring the group's survival skills didn't disappear with any one person. Over time, healers built a functional toolkit: cutting tools, bindings, cleaning agents, and splinting materials, refined through trial and error. These individuals weren't just useful. They were often among the most valued members of the entire community. Despite every effort, many injuries simply couldn't be saved. Severe trauma often meant a slow, difficult decline. Studying ancient remains today reveals just how often deep infections and severe trauma proved fatal, even with treatment attempted. In these cases, care shifted from treatment to comfort, staying close, offering warmth, and easing whatever pain remained. Evidence of deliberate burial, even for the severely injured, suggests these losses were met with genuine grief and respect. Every technique we've covered existed because of losses like these. Hard lessons that shaped better care for the next injury and the next. Nearly every technique used in modern trauma care has roots stretching back to these ancient, hard-won discoveries. Splinting a broken bone, applying pressure to stop bleeding, cleaning a wound before covering it. These aren't new ideas. They're ancient ones, refined. Even trepanation, once considered primitive, is now recognized as an early, functioning form of neurosurgery. Ancient humans had no anesthesia, no sterile tools, and no medical training. Yet they built the foundation everything else was built on. Long before hospitals existed, humans were already saving each other's lives. One wound, one broken bone, one act of courage at a time.